Hello, my name is Reza, and this presentation is my layman's guide to scoliosis. I will go over what it is, its anatomical features, some interesting advancements / research, and finally I will discuss why it should be important to the general population. The first question is, what is scoliosis? To put it very broadly, scoliosis can be defined as an abnormal curvature of the spine. Before we go into more details, I want to first present the anatomical features of what a normal spine should actually look like. A normal spine is made up of flat bones that fit together called vertebrae. There are 33 of these bones in the spine, and the appearance of these vertebrae change depending on where they're located. We have the cervical, thoracic, lumbar, sacrum, and coccyx vertebrae. Next, I'll go over the normal curvatures of the spine. In figure 1a, we see a sideways view of a normal spine where we have 4 curvatures. The thoracic and sacral curvatures are primary because they develop before birth, and the cervical and lumbar are secondary because they develop after birth. These curvatures are completely normal and would not be scoliosis. This is a frontal view of the spine in figure 1b. In this perspective, we should ideally see no curves. An abnormal curvature in this perspective would indicate scoliosis, but not all degrees of curves would be considered abnormal. The modern day minimum for what would be considered as an abnormal curvature in scoliosis is 10 degrees. Any spinal curvature less than 10 degrees would just be a normal variation of the spine. These curves are not scoliosis. Now that we've discussed the normal curvatures of the spine, we can start to expand on what scoliosis is. As previously mentioned, scoliosis is an abnormal curvature of the spine, specifically a left or right curvature that is visible from the frontal or backwards view. 1 or 2 curves can form, resulting in either a C or an S-shaped spine. Before I start explaining the different types of scoliosis, I want to present a list of questions that will appear throughout the slides. Hopefully these questions will make more sense as we go. Each question will pop up when a relevant topic is being presented. There are 3 main types of scoliosis: idiopathic, neuromuscular, and congenital. Congenital scoliosis is usually detected at birth. It is the result of birth abnormalities that affect individual vertebrae. The growth of these vertebrae is hindered, resulting in abnormal curvatures. Neuromuscular scoliosis can progress more rapidly than other types of scoliosis and is a symptom of other conditions. There are many neurological and muscular conditions that can result in scoliosis. Some examples include cerebral palsy and muscular dystrophy. Finally, there is idiopathic scoliosis. This type of scoliosis is the most common, making up about 80% of all diagnosed cases. Idiopathic scoliosis develops during puberty without a known cause or underlying condition. There have been many theories about what causes idiopathic scoliosis, including increased hormone levels during puberty. In general, there are 2 steps in diagnosing scoliosis: a first screening step and then a more in-depth step. The first step the screening step includes a list of physical tests, with the most important one being the forward bending test. A patient will bend at the waist, but will keep their knees straight and their palms together. We can see this test in figure 7, where we can see a prominence on the right side of the patient's back, indicating abnormalities in the spine. Another indicator of scoliosis is an inability to perform the test altogether. The first step of diagnosing scoliosis leads me to my first research question. What is currently being done to detect and treat scoliosis early? Are school screening programs effective? To answer this question, I looked into 3 primary research articles that focus on investigating the prevalence of scoliosis in schools around the world, and I considered if the prevalence rates can justify the costly school programs. Early detection of scoliosis in youths can often be the difference between wearing a brace or enduring surgery. Knowing this information, one would assume that school screenings for scoliosis would be a success, but they are actually controversial. The U.S. Preventative Services Task Force largely called for the end of scoliosis school screenings back in 2004. I looked at articles from Nepal, Turkey, and Brazil. Researchers from these countries performed screens for scoliosis in schools on a large scale. The forwards bend test was utilized in these screens. Brazil had the highest prevalence of scoliosis with a prevalence of 14.4 out of every 1,000 students, and Nepal had the lowest with a prevalence of 1.1 out of every 1,000 students. This lack of prevalence among adolescents seems to suggest a routine scoliosis screen is unnecessary, especially when considering the extremely low rates of severe scoliosis in the general population. Now that we've discussed step 1, or the screening process, we can discuss step 2. Step 2 involves a more in-depth investigation of scoliosis itself. At this point, specialists would usually try to rule out any possible underlying conditions. To do this, family history, appearance, age of onset, and pain levels are all considered and are used to rule out any neurological or muscular conditions that could possibly be causing the abnormal spinal curvatures. After this step, an X-ray can be ordered. The X-ray image will allow a specialist to see if there are other abnormalities causing the spinal curvature. At this step, it would have already been determined if the scoliosis is idiopathic or non-idiopathic. The next action is to use X-ray image to measure something called the Cobb's angle. The Cobb's angle is the standard that is used to determine the curvature of the spine. The higher the number, the more severe the scoliosis is. Figure 8 is an example of how the Cobb's angle is measured. An angle of 10 to 20 is mild, 20 to 40 is moderate, and anything above 40 is severe scoliosis. The long steps involved in the diagnosing of scoliosis brought me to my next research question. Are there any new tools that can help to speed up and improve the diagnosis of scoliosis, especially in relation to the Cobb's angle? Normally, it would take a lot of time and effort by clinical doctors to outline and measure the Cobb's number. This is because of the difficulties involved in manually outlining vertebrae on X-ray images. In this research paper, the researchers outline a way to significantly speed up the process of obtaining a Cobb's angle calculation. The researchers utilized computational tools to outline individual vertebrae on an X-ray image. These outlined vertebrae could then be utilized to easily find the Cobb's number. This would significantly simplify and speed up the calculation, leading to increased productivity, and this would lead to better outcomes. The scientists compared their best performing computational tools results with manual assessments by other clinical doctors and saw that their results were all highly correlated. All of these steps taken by the scientists using their computational tools are outlined in Figure 9. Poogenesis is what comes after diagnosis. The severity of the curvature is the main factor that determines the prognosis of scoliosis. Patients with a 70 to 100 degrees of curvature can suffer from chest defects resulting in breathing issues and a possibility of lung infection. These changes can eventually become life-threatening and can completely decrease the quality of life in patients. As a result, a specialist will always recommend preemptive treatments that can halt the progress of scoliosis, especially in cases of adolescent idiopathic scoliosis, where the immature skeleton has a lot of room for growth. There are multiple treatments that can be utilized depending on the severity of the curvature in the spine. In mild scoliosis, observations and physical therapy are usually enough, while in severe scoliosis, surgery may be required where vertebrae are fused using screws and rods, like what is displayed in Figure 10. This brings me to my last research question, which is using a brace an effective treatment for scoliosis? Can wearing a brace prevent surgery? I analyzed the results and methods of a research article that looked into the effectiveness of the Boston brace, which is a hard shell brace utilized in scoliosis treatment. The researchers tested the effectiveness of the brace on 3 groups composed of 480 patients between the years 2010 and 2020. The groups were comprised of idiopathic and non-idiopathic scoliosis patients with varying curvatures. The results of the study were very promising, as surgery was avoided by 64% of combined population of group A and B, made up of young idiopathic scoliosis patients with curves of 20 to 40 and curves above 40, meaning that 64% of patients never progressed to 50 degrees of spinal curvature. Similar rates were not seen in group C, however, which was composed of non-idiopathic patients. Only 20% managed to avoid surgery while staying below 50 degrees of spinal curvature. However, the treatment did manage to delay the need for surgery by 5 years on average. This study was overall very positive and managed to demonstrate the benefits of using braces as a treatment for scoliosis, especially with adolescent idiopathic scoliosis, where the use of a brace can almost halt the progress of scoliosis until skeletal maturity is reached. Now, to wrap things up, I want to dedicate some time to explain why learning about scoliosis can be so beneficial for the general public. Scoliosis is a condition that can affect the spine. The spine is one of the most important parts of our bodies. Having a fully functional spine enables normal everyday activities, such as standing up, moving around, and even playing sports. Throughout this presentation, I've talked about the importance of early detection of scoliosis and have analyzed the results from the treatments that can almost completely halt the progress of scoliosis if the condition is caught early. Scoliosis affects 2 to 3% of the population here in the US. That makes up around 9 million people that are affected by scoliosis on a daily. To put this into perspective, that can fill up Levi Stadium 88 times. These are my sources. Thank you and have a nice day.